Sampson.
Good afternoon, Madam President. Good to see you up there today, and happy Valentine's Day to you and the rest of my colleagues here in the chamber and everyone listening. I think I will pick up where Senator Summers left off, which is just to talk about the notion that we are voting on a bill, which is House Bill 5047, that intends to take the policy from the governor's executive orders that have been, active, say, for the last year and a half, plus or minus, depending on which one. And the bill before us intends to put us in a position to vote on all of those at once. I have one question, Madam President, just that I think we should clear up before I get into my remarks, and that is there's a lot of confusion out there in the public about what is exactly happening today, whether or not we are extending the governor's emergency, whether we are extending the governor's executive orders, things like that. My understanding is a little different. My understanding is that this body is going to take the place of the governor in declaring an emergency in the bill subsequent to this one. And the bill before us essentially takes the policy that was once the governor's executive orders and puts them into a special act, essentially creating a law enacted by this body. But my question, Madam President, is just to clear up the confusion, is through you to my colleague, Senator Lesser, is this bill, or is rather the resolution that we are going to vote on subsequent to this, required for any of this to be valid or to be in effect? Through you, Madam President.
Senator Lesser.
Yes, thank you, Madam President. Madam President, I do want to answer my good friend from Wolcott's question. I do, before I get there, I was remiss in not wishing you and him and the other members of this chamber a very happy Valentine's Day as well, and I want to associate myself with his congratulations. That said, I think he was asking about a bill that we're going to, or a resolution that we'll be considering subsequent to this that is not related to the executive orders that we're seeking to codify in this bill. Through you, Madam President.
Senator Sampson.
Thank you very much, and I appreciate that answer, and I have no more questions. I'm just going to remark on the bill myself. When we do get to the resolution later, I can promise that we'll have a little more dialogue. Senator Wang and Senator Summers did a great job of kind of breaking down what the bill is and some of the concerns about it. And I want to focus primarily on the subject of masks in schools. But before I do that, I want to say that I am very pleased that we are here today and we are voting on the policy that was contained in the governor's executive orders. It is the very thing that I asked for repeatedly back in July, when we were asked to extend the governor's emergency and therefore his executive orders. I made the point that we were in the building and we should be voting on those policies. There's no reason to let the governor continue to run the state via executive order when we're here and have the means to do so, to make the policy ourselves. And then the same thing happened at the end of September. So I am very happy that we are taking it upon ourselves as the legislature to make the policy for the state of Connecticut. But I would add that I agree with the concerns already mentioned, which is that it is inappropriate, for lack of a better word, to put those 13 items in one up or down vote, knowing full well that there are items that I think have broad support. The policy having to do with temporary nurses, for example, or the free booster shots I know was mentioned, so that kind of thing. Those are things that I don't think you'd get any objection from anyone in this chamber in either party, whereas there are other policy items that are quite controversial and certainly generate a lot of debate. And the masks in schools is the primary one, and I'm going to kind of focus my remarks there, although I may touch on some of the other items. The last year and a half, Madam President, has been less of a struggle with COVID-19 and the pandemic and more of a struggle about personal freedom and whether or not we have a government that follows our American system where the representatives of the people are here to make policy on their behalf, or whether we have a state government that truly believes it's in charge of those people. those promoting the aggressive mandates, I think, have made a big mistake. Their policies have reached a point of angering parents, moms in particular, and because it's essentially interference with the way they raise their own children. And this bill and this concern that I'm raising about the mask section of the bill is about the kids. This whole thing is really about the kids. And your vote on this bill, 5047, will ultimately be about the kids, because to me, that is the overriding issue out of the 13 items that are being contemplated. I've received mountains of emails, Madam President, from constituents of my own and from across this state about the difficulties of parenting through this pandemic, the difficulties of dealing with children who are not wanting to wear masks or have difficulty wearing them, and the side effects of that process. And I am continuously presented with testimony in the form of these difficulties. And we've been seeing it across the state in various boards of education meetings and things like that, and in our email. But what's unfortunate is that we haven't seen it in a public hearing in a proper form, where the people of the state would have a bill before them, the actual language that would become law, to decide whether or not it is effective policy for the state of Connecticut, and then comment on it. That has not happened. I won't beat that dead horse, because my colleagues have already done a good job of talking about the informational hearing that was recently held that was really a slap in the face of anyone who understands this process and the value of public input in it. Anyway, there's a lot we could talk about as far as masks on children. And Senator Summers, she did a great job of covering the science or the data aspect of it. Suffice it to say, I think the most paramount thing we have to remember is that kids have been largely spared the brunt of COVID-19. I don't want to get into the science part. I'm not a doctor, I'm not a scientist, but I do want to talk about some other things. The primary one is that obviously this mask mandate is affecting the quality of education. Teachers need to see kids' faces, and kids need to see teachers' faces, especially if they're in some kind of language class or something like that. And so many teachers have mentioned to me the difficulty of being in the classroom wearing a mask with kids that are wearing masks. It's like basically they're talking back and forth to each other and they can't understand each other. And finally one of them pulls down their mask to talk anyway. Seems to be like a commonplace kind of situation. I'm also no expert about mental health, but the sheer number of testimonies, emails, comments having to do with the impact on mental health for kids in the school system is undeniable. And it's no wonder that both parties in this legislature are introducing massive mental health proposals this year. There is segregation, there is bullying going on in our schools because there are arbitrary policies being adopted about when and where you should have your mask on. I've heard stories about how in the classroom of some schools, there is a very strict mask policy. In the hallways, there's a very strict mask policy, but then at lunchtime, it's a free-for-all. Everybody takes their masks off, and at that point, what does it matter? These policies are affecting all school children, of course, but I would say they're affecting little kids in particular. Little kids are just not capable of wearing masks correctly. I mean, they have little tiny faces, and they fidget, and they touch their faces, and they touch their masks. And I think the worst part of putting masks on small children in particular is that we are teaching them something that I just don't think they should be taught about COVID or anything else, and that is the notion that they should be afraid. There's no question to me that there is a time to end the mask mandate, and that time is now. It is crucial to the health and well-being and the future development of our next generation of citizens. And I may be out on a ledge saying this, but my experience has taught me, as limited as it is, that forcing small children to put a mask on and sit in a classroom for extended periods of time is akin to abuse. But despite all this, Madam President, I'm feeling confident today. And I think that's because the genie's out of the bottle. The wheels are in motion. The last year has been a master class about civics and about how politics truly works. Serving in the legislature in the minority, I think I'm going on my 11th year. It's a difficult thing. When you serve in the minority, you don't often get your way. The most you can achieve is to maybe stop some things you disagree with or to have an impact on the ultimate product to improve a bad bill and make a bad bill better. But the victories are rare. So I have spent most of my political career, despite serving in this chamber, engaging in political activism, going around the state, talking to people, making sure they understand our American system and the value of keeping it. And this last year, I have been busier than ever, traveling around and talking to parents about their concerns, particularly with what's going on as far as mask mandates, critical race theory, things like that, that they can have a direct impact in by speaking up in their local town governments. And my lesson to them has always been the same lesson, really, which is we just simply have to make our position more popular, and we will get our way. We simply have to make it popular to take the masks off, and then our government friends will have no choice but to do so. And we are succeeding. For those people that might be very upset and discouraged out there, especially after the debate and vote in the House last Thursday, I want to tell you to stay strong. Stay the course, stay positive, because we are winning. It's not instant success. We may not get everything we want here today. Presumably, when bills come before the legislature, they pass. It's not like the majority to put bills on the board and have a debate thinking that somehow the outcome is uncertain. But don't let that disturb you. The end is in sight. At some point in the very near future, this mask mandate will be gone. And many, many more elected officials on all levels of our government will have learned that they need to respect the will of their constituents. The pressure that has been building over these recent weeks is going to continue to intensify. And in the end, parents will ultimately once again decide what is best for their children on the subject of masks in schools. I also want to just say one quick thing, too, which is the argument for parents' choice is about freedom. And it was brought to my attention that there are some people that are offended by the notion of freedom because they say that it's irresponsible. But I want people listening to understand that if you feel that way, you should know that the people advocating for parents' choice and freedom are more than willing to accept the consequences. They do not want freedom without responsibility, but they do want the right to make the choices for themselves. I mean, as far as the bill goes, I just want to say, following up, Senator Lesser more or less pointed this out, which is that the governor has pretty much told us that February 28th, that's the end of the mask mandate, and there's no reason not to believe him. I would say that's the best case scenario of this bill. There's a best case scenario and a worst case scenario. The best case is that we believe what we're being told, which the governor says the mask mandate ends on February 28th. The House Democrats during that entire debate repeated it ad nauseum. We know that the bill says something different, but the governor is going to make that determination, and his agency personnel are going to follow through. Don't worry, they say. And that will effectively end that mask mandate, at least for the foreseeable future. The thing is that there is a worst case scenario, too, and that is what the bill actually says, because what that is a little bit different. It effectively gives power to the three agency commissioners, the State Department of Education, the Department of Public Health, and the Office of Early Childhood, to make binding mandates on whether or not masks are in schools all the way through the end of the school year, June 30, 2022. And I think the concern is, from people who are reading that in the bill, is that this essentially creates almost like a thinly veiled deception, to take the responsibility off the governor, because he's no longer extending the emergency or his executive orders, and it takes the heat off the majority party in this body, because they're essentially not going to perpetuate the mask mandate either. They're going to give it over to some unelected bureaucrats who will ultimately make that decision. It's very similar to the way I view electricity rates. Our electric rates continue to go up and go up and go up. And there was a time when this body used to actually have a lot of input in the ultimate vote up or down on whether the rates would go up. But at some point in time, a clever device was created, and that was to create the Public Utilities Regulatory Authority, which is a unelected body that ultimately has the responsibility of voting to raise those electric rates, giving the legislature free rein, essentially, to create policy that drives up the cost of electricity without ever taking the responsibility for making that decision themselves. I bring that up because it's exactly what I pointed out before. The freedom to make these policy choices should come with the responsibility of the consequences. I don't think that's happening here. I really don't. I think there is some danger in the way the bill is written, that what's going to happen is you're going to end up putting an undue amount of pressure on local governments to make hard choices, because they're going to be hearing some guidance from their local health district. They're going to have parents pushing them in one way, other parents pushing them another way, and I don't think that's appropriate. But at the end of the day, I am confident, and I would agree with Senator Lesser, that I believe the best case is what will happen. I believe the governor will follow through, and his agency personnel will let February 28th be the deadline, at which point the mask mandate will be lifted. And part of that is simply because of the political pressure that continues to grow to force that to happen. I just want to take a moment, because the larger point of my conversation with the chamber today is about the nature of what we're doing, not the exact details. We could talk about these 13 items in some elaborate way and get down to the nitty-gritty on them all, but really what this is about is the way we make policy in the state and why it's so imperative that it changes. And I'm afraid the only way it really changes is if the public gets engaged enough to force that change, the same way we talked about political activism earlier. There are two concepts I want to remind every senator of, though. And the first one is the notion of the concept of the consent of the governed. And there are so many bills where that concept has been ignored in favor of government control. The hearing that we referred to that took place recently in place of a legitimate public hearing where a bill was crafted and put before the public for public comment, and instead just a artificial informational hearing that was limited in time and scope and with no actual legislation to review is an example of that. The legislative process that took place over the last year and a half, where much of it took place behind a TV screen, on a Zoom meeting, that kind of thing, which has its benefits for sure, but it also has its drawbacks. These things are limiting the consent of the governed. Just for example, I'm very much in favor of allowing for Zoom meetings and hearings to continue, and I think that's a great idea because many, many people were able to participate in our process that never did before because of that access. But simultaneously, you are shutting out the ability for individual citizens to come before their elected representatives and speak to them face-to-face in person. And if you've ever seen one of these Board of Ed meetings recently, especially with fired-up, angry moms concerned about their kids being forced to wear masks against their better judgment, you know how important that is. And we can never, ever get away from that. I've also keep hearing the words let and allow. These are words that elected officials should never, ever use when referring to their constituents. But I keep hearing them over and over again. I don't want to point out any significant examples, except I think the governor's comment on Twitter that people have finally earned their freedom stands out as something that he really should think better before he takes to Twitter, something that other people might accuse some prominent politicians of. These are examples of how this body has lost its way in some respects. Consent of the governed means that we only exist because the people allow us to. We have a government of, for, and by the people. And by its very nature, if the people decide that they don't even want this form of government, our founding documents say we should be able to change or get rid of it. That should be a reminder to us of just how responsible we are back to the people that elected us. And all of these mandates and 2 years of really a speculative definition of what an emergency is flies in the face of that. The other thing that is missing from the way we do business is the rule of law. America is an amazing, amazing place. And one of the reasons why we are so amazing is because one of the first things that our country did was to say we must have a written rule of law. The founders had declared their independence from an authoritarian form of government in the form of King George. And King George could decide whatever he wanted at any given day. If he didn't like somebody, well, off with their head. If he wanted to impose a tax, if he wanted to change a policy, he just did it. And he could change it back the other way the next day if he wanted to. We don't operate that way on purpose. We have the rule of law, not the rule of man, or the rule of the king, or the rule of the governor. We have the rule of law, which means that we actually take the time to sit and debate on policy, and then we draft it into a law that is written down in words that are clear to everyone. So no one can misunderstand what that means. And on top of that, it applies to everyone the same. Well, this last year and a half has been all about the rule of man. So many different policies being crafted by so many people in, places of power. It's wrong, Madam President. And some of this happens in ways that are hard to believe, and people being put in these positions without even wanting to. School principals, for example, being told that they're the ones that have to implement some kind of policy in their school about COVID. And they're just arbitrarily making their own policies about whether or not they should put plastic dividers between things or allow the kids to take their masks off for a 10-minute break or not. So it's not being implemented the same anywhere, for one thing. So the law is not being applied equally, and it's being applied arbitrarily. That has to end. If we're going to have policies like this, we are going to debate them. We are going to consent to the governed, what policies they want us to implement, and then we're going to follow them to the letter of the words on paper. It's so frustrating to hear our government officials say they are allowing certain behavior. There was a question earlier Senator Summers asked about what authority the agency commissioners would have about, I forgot it was, primary providers or something like that. And the answer was, well, it's at their discretion. That's the wrong answer, Madam President. It should be written down. There should be a definition. It should be understood by anyone who reads it. Oh, I understand exactly what this bill and what this law actually does. Not the discretion of some agency personnel. So just back to masks, and I will wrap up right here. A couple of very important points that I think people should understand about this whole situation when it comes to masks. The first one is that people are not stupid. Let that sink in for a second. The people that we represent are not stupid. If the pandemic changes tomorrow or next week or a month from now, and it becomes truly necessary for people to put masks on their children to prevent them from getting sick or worse from COVID-19 or something else, they will put the masks on themselves. We don't have to tell them that. People are not stupid. And ultimately, if there was a virus that was so dangerous that we needed to put masks on children to prevent them from getting sick or dying, I don't think they should be in school at all. At the end of the day, the only solution to this problem is for our government to act in the way it was intended, which is that we should be gathering the information necessary to provide our constituents with the ability to let them exercise their constitutional rights and freedoms and make their own personal choices and those for their children. And that being said, Madam President, I have an amendment. It is LCO 1121. Would the clerk please call that amendment?
LCO number
Mr. Clerk.
LCO number 1121, Senate Schedule A.
And Senator Sampson.
Thank you, Madam President. I move adoption of this amendment, and I move to waive the reading, and I seek leave of the chamber to remark just briefly on what the amendment does.
And the question is on adoption. Will you remark further, sir?
Thank you very much, Madam President. This is a very straightforward amendment. It essentially does what we've been talking about, which is it removes the mask mandate from under the authority of the various agency commissioners and even from local government control, and restores what I believe is the only appropriate decision maker, the parent, as the person that would make the choice. And it does this by via allowing for an opt-out. So if you read the language in the amendment, it's pretty straightforward. It says very simply that parents of a child enrolled in a licensed child care facility shall be permitted to opt his or her child out of any requirement concerning masks or cloth face coverings. And then the second section is much broader, and it says, except the parent or guardian of a student shall be permitted to opt his or her child out of any such requirement, and so forth. As I said, I move adoption. I think this is the only path forward for us, Madam President. This is the right thing to do. The people that were outside on opening day, this is what they want. And I believe it's our obligation to give it to them, since we represent their wishes and we exist only because of their desire to have a government of, for, and by the people. Thank you very much.
Thank you, Senator. Will you remark further on the amendment, Senator Lesser?
Yes, thank you, Madam President. Madam President, through you, a few questions to the proponent, of the amendment.
Senator Sampson, prepare yourself. Please proceed, sir.
Yes, thank you, Madam President. Through you, what's the effective date of this amendment?
Senator Sampson.
Thank you, Madam President. I appreciate the question. This amendment would be effective immediately. I am not certain whether it conflicts with the existing executive order that expires tomorrow, but I don't know that that's very important, being that that's tomorrow. Thank you, Madam President.
Senator Lesser.
Yes, thank you, Madam President. And just reviewing the time, I think it's about 1:05 in the afternoon. Through you, if this amendment were to take effect immediately, how much time would school teachers, daycares, school administrators, I hear regularly from superintendents in my district, the 5 towns that I represent, school board members have to figure out how to conduct school now with a really vast change in policy about keeping kids safe in the pandemic? How much time would they have to adjust to this amendment?
Senator Sampson.
Thank you, Madam President, and I appreciate the question. I am quite confident that these local school districts do know how to operate a school without a mask requirement, since they did prior to COVID.
Senator Lesser.
So how would, through you, Madam President, how would this language of this amendment, which would remove masks immediately with no planning time at all, how would that work with the screen and stay policy that Senator Summers referenced earlier? Through you, Madam President.
Senator Sampson.
Thank you, Madam President. I don't believe it does. And I also would say that I think news travels fast is the best way I would put it. And I believe that if this body were to adopt this amendment, it would still have to go back to the House to be adopted. But at that time, I believe that within hours, maybe minutes, every school district would be well aware. And within several hours, I think every parent would also be aware.
Senator Lesser.
Yeah, thank you, Madam President. Madam President, over the last few weeks, I've heard from many school teachers all across the state. I've heard from school administrators. I've heard from boards of education. I was just meeting with 2 members of a board of education in Newtown the other night, which is not a community that I represent. And people were all trying to figure out, if we move forward on ending the mask requirement, if we were to really pitch this to school districts, how is this going to work in my community? And that's what I heard over and over and over again. But rather than giving them time to figure that out, rather than giving the Commissioner of Education in collaboration with the Commissioner of Public Health the ability to provide some guidance to these districts, this amendment, Madam President, would short-circuit the process. It would provide a massive, historic, unfunded mandate on our teachers and our school districts saying, you got to figure it out right now. Drop what you're doing. In the middle of the school day, we're going to demand that you figure this out right now. No 2 weeks to figure it out. You have 2 minutes to figure it out until whenever the governor gets around to signing this, which could be this afternoon. Madam President, this is a stunningly irresponsible amendment. There is nobody in this chamber who's saying we are going to have a permanent mask mandate. We've heard from both sides of the aisle that masks do have an impact on kids. Nobody wants to have their kid masked if not necessary. But saying that this has to happen this afternoon, I think is not the way forward. It's not what any superintendent I've talked to wants, not what any teacher I've talked to wants. It just does not seem like the responsible way to operate. Now, there's a separate provision. I think earlier, before introducing this amendment, I heard the gentleman discussing the worst case scenario, which is the worst case scenario is that the permissive language in the underlying bill says that, God forbid public health necessity dictates we're allowing the Commissioner of Education and the Public Health Commissioner working together to issue guidance saying that, we could allow masks in place in some circumstances in the worst case through the end of the year. And that's what I understood the gentleman to outline as the worst case scenario. But I don't think that's the worst case scenario. Through you, Madam President, has the senator seen a report that came out, I think over the weekend, about a recent increase in a condition called multi-system inflammatory syndrome in children?
Senator Sampson.
Thank you, Madam President. I have not. And if I may, I just want to respond briefly to the previous remark, which is that there is no requirement in this amendment for every child or every school district to take masks off. There is only the choice for parents to opt out of the mask requirement. I'd say that's a very large difference.
Senator Lesser.
Yes, thank you, Madam President. And while I understand that, we are seeing a dramatic change in the way that every school classroom in the state operates, potentially this afternoon, which I think is not responsible. I can't think of anything that would be less responsible. But going back to my question, which was about this recent report, it was in the Hartford Courant. There was also a version in the Connecticut Mirror. It's discussing what we're hearing on the ground. There's a hospitalist at the Connecticut Children's Medical Center named Alex Hogan, who's quoted as saying, last week we saw 10 admissions for this condition, a very serious condition, multi-system inflammatory system C, double the most the hospital has ever had. Now, I don't want to be an alarmist. I don't mean to say that we know everything about COVID-19 or how it's changing and evolving. But the idea of tying our hands and saying that regardless of what comes out, regardless of, we just had the Omicron variant, whatever, regardless of what the next thing is, we are not going to give school districts and our public health commissioner and our commissioner of education the tools they need to respond to potential future changes in the virus. Seems a little strange to me. Through you, Madam President, if there were to be a new variant of concern, would this guidance give the public health commissioner the ability to order remasking of kids in schools if the situation warranted?
Senator Sampson.
Thank you, Madam President. Absolutely not. It
Senator
would
Le-
allow, I'm not quite done.
Sorry.
It's quite all right, Madam President. We're all a little rusty, coming back after a small hiatus. Let me say that the answer is no, but the DPH and the other agency personnel are still able to provide guidance, as I suggested earlier, is the appropriate role of government, so that parents can make their own individual choice. And I would argue that it is irresponsible to let unelected bureaucrats make choices for the children of their own parents without their consent. That's what I consider to be irresponsible. And I would also say that I find it strange that someone would think that that's a better policy than informing parents so that they can make their own proper choices for their own children.
Senator Lesser.
So thank you. I wasn't prepared to ask another question, but the gentleman's comments sort of moved me in that direction. So if the Commissioner of Public Health were to, working with the Commissioner of Education, were to give guidance to school districts, to superintendents who are looking to figure out best practices to keep their schools safe, provide guidance to school teachers on how to keep their classrooms safe, is there anything that would allow, is there anything in this law that would allow local boards of education, local school districts, principals, teachers to follow that guidance? Or does this amendment tie their hands and say, you know what? You lose that ability to manage your own classroom. It's no longer up to you.
Senator Sampson.
Thank you, Madam President. I think that depends on what the guidance is. If it has to do with whether or not an individual child is going to be wearing a mask, that it will be up to their parents if this amendment passes. The other guidance, we'd have to speculate about what it is, but as long as it is not in violation of our Constitution and it is lawful in the state of Connecticut, I presume that they'd be able to continue it. The social distancing policies that are being enacted in schools across the state for the last couple of years, I think those would remain. This amendment is very simple. It only affects one policy, and that is whether or not parents have the right to make the final determination about whether their children should be masked or not. It's not going to create an upheaval in the school system. Some kids will come to school with masks and some will not. That's what will happen as a result of this. That is not a major change that requires input from a school district, administration, and so forth.
Senator Lesser.
Yeah, I hear the gentleman. I just respectfully disagree, Madam President. And I just think that right now we are dealing with teachers, with boards of education. My goodness, I am so grateful that I get to serve as a state senator and not have the hard work that local boards of education have been dealing with, because they're in a really, really tough position, trying to make sure that kids are learning in the middle of this pandemic. They are real heroes of our state right now. And right now, we are putting a lot of responsibility on them. And if this amendment were to pass, it would take away any tools they have to follow public health guidance. It would put them in a really impossible position. So, you know, Madam President, I just think that this is a really irresponsible amendment. I think it would cause chaos this week in our schools. I think it's the wrong way to go, and I urge members to reject it.
Thank you, Senator. Will you remark further? Senator Kissel. Have all the senators voted? Have all the senators voted? The machine will be locked. Mr. Clerk, would you please announce the tally?
LCL number 11-1. Total number voting 34. Total number voting yea 13. Total voting nay 21. Absent not voting 2.
Thank you. The amendment fails. Will you remark further, Senator Sampson?
Thank you for the recognition, Madam President. Yeah, so I'm a little disappointed that amendment failed. But there's a theme building in the debate on the legislation before us. And really, it's a question about trust and where you place that trust, whether you place that trust in the parents to make decisions for their children, or do you place trust in the government to make decisions for them. And I have another amendment, Madam President, which is a very similar topic. And let me call the amendment first, actually. It's probably the best way to go forward. The clerk should be in possession of LCO 1122. Can you have the clerk please call that amendment?
Mr. Clerk.
LCO number 1122, Senate Schedule B.
Senator Sampson.
Thank you, Madam President. I move adoption, and I'd seek leave of the chamber to remark on this amendment.
And the question is on adoption. Please proceed, sir.
Thank you very much, Madam President. This is a very straightforward amendment, and there's a small backstory, and that is that early on when the governor issued his executive orders that would require various state employees and some folks that contract with the state to be vaccinated as a condition of their employment, included in that requirement was the ability for those employees to exercise their religious freedom and object to being vaccinated on religious grounds. Subsequent to that, I received quite a few phone calls from concerned constituents who work for the state and for other institutions that contract with the state. And they were being told that they needed to justify their religious beliefs in one form or another. Sometimes they had to complete a essay explaining their religious beliefs. Sometimes they had to provide documentation from their clergy. Sometimes they had to answer questions, essentially placing some other state employee, a unelected person in the bureaucracy of the state of Connecticut, in charge of determining the validity of that person's religious beliefs. And I find that unacceptable, Madam President. So the amendment before us simply modifies 3 of the provisions in the bill before us that reflect the policy that exists in the executive order numbers that it comes from, 13G, 14C, and 14B. And I will just put this in layman's terms. What this amendment would do, it would eliminate that policy of allowing the state to make a determination about the validity of someone's religious beliefs and allow that employee simply to exercise their religious freedom, and all they would have to do is object to such requirements on religious grounds by issuing or submitting a written statement, is the exact language in that amendment. And I believe that this is something that is absolutely necessary. We just debated whether or not we trust the government to make decisions on the care of the children of our citizens. And the other concern that I'm addressing in this amendment is whether or not we believe the state government has the right to determine whether or not anyone's particular religious beliefs are valid. And I believe this is unconstitutional in several ways. It goes against the First Amendment of the U.S. Constitution on its face. And I think it's also contradictory to our state constitution, and I'm happy to discuss that with anyone who might have questions. But either way, I think this is an effective policy to show that here in this body, we respect the First Amendment and our citizens, the constituents that elect us, and we respect their right to have their own religious beliefs and exercise them in the case of this vaccine requirement. And those are my remarks, Madam President, and I encourage my colleagues to please do the right thing and vote in favor of this amendment.
Thank you, Senator Sampson. Will you remark further, Senator Lesser?
Yes, thank you, Madam President. And Madam President, I was a little bit surprised earlier this afternoon when the gentleman proposed what I viewed to be a massive unfunded mandate on our state's municipalities and school districts. But that was not the biggest surprise for me here today, because here we see the honorable ranking member of the Labor Committee proposing a massive mandate on the state's employers. Through you, Madam President, to the honorable senator, would this mean that a covered employer, if they were a private employer, would not be able to figure out if this were in fact a sincerely held religious belief? They would lose the ability to manage their own workforce enforcing the law in Connecticut. Through you, Madam President.
Thank you, Senator. Senator Sampson.
Thank you, Madam President. I would be better able to answer this question if the gentleman described in detail either of the, quote, massive mandates that I have proposed. Through you, Madam President.
Senator Lesser.
Yes, thank you, Madam President. Yes, so the text of the amendment seems to apply to 14B, the executive order that's currently in effect, which applies to long-term care facilities, for example. Now, this is a if this goes away, I would imagine the long-term care facility would lose an ability to manage their own workforce. That would seem to me to be a mandate on employers. Through you.
Thank you, Senator Lesser. Senator Sampson.
Thank you, Madam President. This amendment has nothing to do with lecturing or determining or using government force to tell any particular private business how to manage their workforce. This amendment is to save the state of Connecticut the aggravation of being sued for violating the First Amendment religious freedoms of people employed directly or indirectly by the state of Connecticut. Through you, Madam President.
Senator Lesser.
Well, I respectfully, Madam President, I disagree with that, because hospitals, nursing homes, long-term care facilities all around the state are doing their level best and have since the onset of the pandemic to keep their patients, their clients safe, to keep their workforce safe, to minimize the spread of the disease. And we've seen all too often the tragedy that can befall when they're not able to do that. One of the most effective ways that they can do so is to make sure that their staff are vaccinated, to prevent spread of the COVID-19 disease to vulnerable populations. That is incredibly important. Not only is that a public health measure, but it's something that responsible employers are doing to try to keep their patients safe. And if I, as a caregiver, want to place a loved one, want to make sure that they can get the best available care, one of the things I'm going to be looking for is whether or not staff are vaccinated. When I look at the text of this amendment, it says, you know what, we are going to take away that tool from employers. We are going to say that it's not up to them. This is not between an employer and an employee, but rather we're going to say that the state of Connecticut is jumping in and telling an employer, no, you just have to accept a signed piece of paper, and that is the limit of your ability to scrutinize this claim. To me, that's an astounding and very dangerous step by the state of Connecticut. I would hope that that's not what this amendment, but that's my reading of the amendment, but I hope that that's incorrect, and maybe the gentleman could show me where I have it wrong.
Senator Sampson.
Thank you, Madam President, and I appreciate the question from my colleague, and I assure him he is indeed incorrect. Nothing is changing here except for whether or not we are going to empower an individual to determine the validity of someone else's religious beliefs. The policy that is being continued in the underlying bill that existed in the executive orders already sets the parameter that a religious exemption is accepted. So I'm not forcing a change on anyone other than to say that no one should be in a position to determine whether or not someone else's religious beliefs are valid. And I believe that is a dangerous precedent that was established by the way the state government operated previous to this amendment. And I believe it is beneficial not only to the state government, but to that long-term care facility, if that's the interested party, and everyone in this room, to make sure that it's very clear that in America, one's religious beliefs are their own. They are protected by our U.S. Constitution and our state constitution, and there is no way that it would be proper and even smart to avoid being sued to be setting up parameters that say otherwise, where some third party is going to make a determination of whether someone's religious beliefs are legitimate. So to answer the question in a simpler way, the religious exemption already exists. I'm not creating a religious exemption. That religious exemption already exists in the policy.
Senator Lesser.
Yes, thank you, Madam President. Earlier this morning, the senator from the 28th District and I had an interesting colloquy about transparency and the value of soliciting input into the decisions we make as a state Senate. We were discussing the public information hearing that happened yesterday, and I was curious in formulating this mandate on employers that prohibits them from scrutinizing a claim, a bogus potentially claim of a sincerely held religious belief, and calling them I believe in the words that were just used, a third party. Was there any dialogue with the state's business community? Has the Connecticut Business and Industry Association, for example, been invited to weigh in on this language? Is this something that would be an imposition on the employers of the state of Connecticut? Through you, Madam President.
Thank you, Senator Lesser. Senator Sampson.
Thank you, Madam President. I appreciate the question, except the questioner lost me when he said bogus religious belief. So if you could clarify what that means, I might be able to better answer the question.
Senator Lesser.
Yes, sir. If that was what the gentleman heard, then I apologize for that. What I intended to say was a bogus assertion. The whole point of the gentleman's comments before were that this was an assertion of a sincerely held religious belief. And one of the things that an employer has to do, or anybody, is to determine whether or not a belief is in fact sincerely held. If I say that I have a religious belief that I drive regardless of what the speed limit is, or I can that any law does not apply to me, I think the first thing anybody would want to do is to find out whether or not that is in fact my belief, or whether or not I'm just simply looking for an excuse to get out of something I don't want to do. And so that's what I intended. I'm certainly not disparaging anybody's religious beliefs. Through you, Madam President. Hopefully that was clarifying.
Thank you, Senator Sampson.
Thank you, Madam President. First, I would say that there is no widely accepted religious exemption to how fast you drive an automobile, but it is a widely accepted practice to offer a religious exemption for someone who does not want to accept a medical procedure. And second, I would say that the mere fact that an employee would issue a written statement saying that they object on religious grounds is satisfactory from a constitutional perspective in respect to the First Amendment. The notion that some other person would be able to interrogate or investigate to determine whether or not their beliefs are sufficient or satisfactory, especially in the case of a bureaucracy, is not what is intended by the founding documents of our country, and I think goes against our American system where people's religious beliefs are respected. Through you, Madam President.
Thank you, Senator. Senator Lesser.
Yes, at the risk of repeating myself, Madam President, I missed an answer to my question. Discussing the American system, I believe my good friend would argue that the American system is based in part on free enterprise. Was our state's business community consulted in drafting this language? This is the first time I've seen this language. Were they consulted, and have you heard the potential impact of this language on our business environment? Through you, Madam President.
Senator Sampson.
Thank you, Madam President. Irony abounds that I would be questioned on whether or not I am in favor of capitalism or free markets in this chamber. I have stood here time and time again attempting to protect and preserve that system in this chamber, and I continue to do so here because I believe it is in the absolute best interest of any of these employers not to interfere with the religious freedom of their employees. They do so at their peril. Through you, Madam President.
Thank you, Senator Lesser.
Madam President, I don't mean to beat a dead horse, but I didn't get an answer. Were they consulted? Yes or no?
Senator Sampson.
Thank you, Madam President. No, they were not consulted, and at least not by me, but that's not relevant. We make a lot of our determinations in this chamber based on the input from our constituents, but we don't make every decision based on their input. We also have a direct obligation to protect the rights of all of our constituents, whether it is the business that we're referring to as affected or their employees, who I certainly did hear from, or any other interested third party. The principles are what are at stake here, not the opinions of some business organization or any particular employer. The principle is that people in this country have religious freedom. It is an accepted practice to allow them to object on religious grounds to prevent a medical procedure that they do not want. And I'm not even creating that policy. That policy was created at first by the governor, and second, in this bill that you are a proponent of and have been encouraging us to vote for all afternoon. I'm simply suggesting that we make that religious exemption clear to mean that there is no one that can dictate to another person whether their beliefs are acceptable or not. Through you, Madam President.
Thank you, Senator Lesser.
Yes, thank you, Madam President. I want to thank the gentleman for his answers. You know, I guess if the potential stakes of this amendment weren't so serious, right? Changing the way a hospital, a long-term care facility, a nursing home can operate, tying their hands and potentially exposing our parents, our grandparents to unvaccinated folks with no apparent safeguards, with no public input, with no public hearing, with no even discussion with those nursing homes, those hospitals, about how this will impact the safety of the people of Connecticut. If it weren't so serious, we could have perhaps a different discussion, and I would love to have a high-minded discussion about the values of the religious liberty and how important that is to this country. But to me, this proposal seems a little half-baked. We haven't even had conversations yet with the stakeholders, and you're asking us to amend this legislation to create a brand new loophole in how the state can respond to COVID-19. Not only the state, but also critical frontline healthcare providers. To me, that seems irresponsible, and that's why, Madam President, I must urge my colleagues to reject this amendment. And Madam President, I ask that when the vote be taken, to be taken by roll.
Thank you. A roll call vote has been requested, and when we take it, we will do that by roll. Senator Sampson.
Thank you, Madam President. I will just follow up the recent comments by suggesting that it's ironic once again to be concerned about whether or not every party was consulted before this amendment was before this chamber. We heard ad nauseum accounts of how the public was not consulted before this bill came before this chamber, about how people were denied access at a public hearing to even see the language of this bill before we debated it. And many people who had signed up for a 6-hour hearing, which could have potentially been a 20 or 30 or 50-hour hearing, that they were denied access. So all I can say to that is that irony abounds. And this is a good amendment. This is an amendment that is in keeping with our value system as Americans. It protects the First Amendment rights of workers in Connecticut. I urge adoption. Thank you.
Thank you, Senator. Will you remark further?
LCO number 1122 of House Bill 5047. Total number voting 35, total voting yea 13, total voting nay 22, absent not voting 1.
And the amendment fails.
I'm going to rise briefly in support of the amendment that's before us that would take the decision over whether or not a mask mandate would exist and move it from what the underlying bill requires, which is the authority of the executive branch administration of the DPH, SDE, and OEC agencies, and turn it into a local control matter where local boards of education would be the ultimate decider. I stand by my position, of course, that ultimately it should be the parents who make the final decision about whether or not their child should wear a mask. I trust parents to make that choice every time. However, since that amendment did not pass, this is the next best thing. We've seen already movement from the governor doing it as an edict on the state to now a proposal that's before us to put it in the hands of the legislature. This moving it even closer to home would be advantageous. And I would also encourage, if this amendment is adopted, and it should be, and becomes the law of the land, I would encourage those local boards of education to do exactly that. Empower local or empower parents to make the decision. That should be the decision that you employ if you are in that ultimate role. So I urge adoption of the amendment, Madam President, and thank you very much for your indulgence.
Thank you, Senator Sampson.
LCO number 1104, that's Senate Amendment C of House Bill 5047. Total number voting 35, total voting yea 13, total voting nay 22, absent not voting 1.
The amendment fails. Will you remark further on the legislation before us?